Good evening, ladies and gentlemen. Sorry, I happened to be the last speaker because I'm going back this evening, so we had to. Well, actually, just highlighting some issues here regarding the delay in childhood immunization in the context of a crisis situation. I did a study many years ago as my medical school dissertation when there was a war in Sierra Leone, and because of that, a lot of the children lacked sufficient immunization. And many years down the road, we still have now the similar situation evolving with the Ebola in West Africa, especially in Sierra Leone. So we have, instead of a conflict situation, we still have a crisis situation whereby most of the children have already missed their immunization schedule, and the situation is still not over. So we have a bit of what I call a humanitarian catastrophe evolving because they are not being immunized. And so I thought I could highlight this issue amongst colleagues so that at least we have it at the back of the mind as food for thought. And so this is why specifically I came to see how I can highlight the issue. But before I go further, officially I work for the Swiss government in the area of clinical trials regulation. I'm a clinical study reviewer with Swiss Medic. As a disclaimer, Swiss Medic has nothing to do with my presentation here. I'm only doing it as a West African, trying to highlight a problem going on in my continent of origin. So I have to make that very clear that Swiss Medic has nothing to do with what I'm saying here. They are well informed I'm here, but that's it. So I'm officially representing the Afro-European Medical and Research Network. So basically, that will be my short outline of the presentation. The rest assured will not be more than 10 minutes. There are a lot of pictures just to show around and share, trying to look at this issue from a positive perspective while trying to, at the same time, bring out the message. So I will talk a bit more about the Medical and Research Network. Then I will home in on the context and background of immunization in crisis situations, especially for children. And then we talk about the expanded program of immunization in Sierra Leone as a prototype for West Africa or for low-income countries. And then briefly go through the study that we did, or I did for my doctorate, for my medical school thesis, and the methodology, the study population, the analysis, the conclusion and implication for the current situation that's going on in Sierra Leone, Liberia, and Guinea. So as I said, I represent the Afro-European Medical and Research Network, a network of healthcare professionals from all over the world, trying to give back to our continent of origin, Africa, Asia, you name it, we are represented in almost every continent around the world. And I am the founder, and we're pushing it forward. And then we have this vision, we're non-governmental, and serve as a sort of knowledge network so that at least we can generate evidence that will be locally applicable, like the problems I'll be highlighting in the context of delayed immunization in children. And we are quite small, from a small country in Switzerland, but at least we cover quite a lot of areas all over the world, and that is where our network members are quite active at the moment. And then that's our office in Bern, Switzerland. And these are the populations that we're actually thinking about in the context of crisis. As I said, in the evolving Ebola crisis in West Africa, the vulnerable population of women and children are always at the focus because at the end of the day, they suffer most. And then we try to empower the younger generation with evidence so that they can have evidence-based practice in every aspect of their professional life. That is one of the motto of our network. That was in Liberia. We set up a knowledge center so people can access internet locally. And we collaborate with lots of institutions, academic. We collaborate with the World Health Organization, of which I'm officially affiliated with WHO, as well as the United Nations. So, and then we take our concept to the field in the form of mobile clinics, which unfortunately we cannot do anymore because of, in West Africa, because of the evolving Ebola crisis. And those are some of the pictures for the mobile clinics in Kitale, Kenya. And then we collaborate, this is in Sierra Leone. And we bring our little generated evidences to the international forum, like what we are doing here today, to share with you the simple thoughts that we have. That was a conference in Bern, Switzerland in 2008 with a lot of participants. So now, having set that stage with a lot of pictures to lighten up the mood, I will share with you what we did about a couple of years ago. And immunization is crisis situation, be it natural crisis, be it man-made crisis, always take its toll on the vulnerable population, especially the women and children, or more so the children, because they are double affected because their mothers are affected. And in such situation, there is destruction of infrastructure and loss of skilled personnel, be it conflicts, be it the current Ebola crisis in West Africa. It has taken a huge toll on the front runners of the healthcare workers. And then, taking the context of the crisis and civil war in Sierra Leone in 2000, when the war officially ended, or 2001, the immunization coverage for all diseases targeted by the expanded program of immunization called EPI is in most instances similar or below the level before the crisis occurred. And so I look at this situation, taking it from the historical context. We are in the EPI program that was started in Sierra Leone in 1974, covered 6 immunizational diseases: tuberculosis, diphtheria, tetanus, pertussis, measles. And by 1990, that's what the aim of the UNICEF and the entire world, 75% of children aged 12 to 23 months were found to be fully immunized. Unfortunately, that was the same year that the crisis broke out in Sierra Leone. And so we had a deepening of this well, nicely achieved United Nations supported goal. So in 1990, that was it. And from the beginning of the war, the immunization coverage was nothing to write home about, as everything was a total crisis. And so my study of my aim by then, when I was finishing my medical school in 1998-99, this was to look and estimate the immunization period, having myself experienced the madness of the crisis that was going on in Sierra Leone. So we look at the 6 immunizational diseases in the various age groups, and the specific objective for the present analysis so as to determine the status in different age groups. Incidentally, by then, the WHO, we are looking at you are either fully immunized or you are not fully immunized. And then we created another group called the age-appropriate immunization. And we designed a cross-sectional study and adapted the standardized WHO multi-stage sampling, cluster sampling, where you identify 30 households. You can either spin a bottle to make sure you start randomly and start from a particular household. And we recruited the standard number of study units per strata. And then, of course, we have to exclude children from the destabilized refugee camps because those are not the normal. They were not accessing the normal healthcare delivery system. They have specific people catering for them. So it's always to be a bias because there you don't have the real story that you want in the general population. And then, so these are the methodology we use. We ask the mothers of the children less than 36 months of age to bring out their under 5 cards, which is a standard, what we call the immunization card. Sierra Leone was called the under 5 card. We examine them to see what are the card retention rates. Of course, the cards were used for other issues, for the mothers during the war to keep their money, etc., so that people don't know that they have monies in there. And we have other things that we use to verify the data. And we had to compare the BCG coverage rate, which is normally, as soon as the child is born, they normally have a BCG given to them. And so the population was from Kisimes mess. It doesn't mean it was a messy area. It means it's the military mess. That's what it's referred to. And then in the eastern part of Sierra Leone. And these are the eligibility criteria for the children. And that's for the population by then in 1999. And then the healthcare availability to the residents was basically for the peripheral health units provided by the list, as you can see there. And half of all immunization were actually delivered by the lower healthcare professionals, which was more or less like a community-driven initiative. And so using the standard WHO cluster methodology of sampling, we included 286 children who received a total of 1690 vaccine. And the card retention rate, those cards we can actually verify for the mother was quite 87%. The reasons I've already elaborated why this could have been when they were using it for other purposes. So to have different reasons, secondary reasons to retain the card. And we created these 4 categories. Either the children were fully age-appropriate immunized according to the WHO. That means if you're at 6 months, you normally have your 0 at birth, your 6 weeks, your 10 weeks, your 14 weeks, and then you have the booster dose 15 months, 18 months, and 24 months. So for instance, if the child is 9 months, we expect that fully immunized for age means you have received all those immunizations necessary for your age. And if you are age inappropriate, this means the children were given the immunization, but they were like catch-up immunization, which means they are not fully covered, because you have to immunize at a specific timeline set by the colleagues or the powers that be. And then the partial immunization, of course, if they were of age but did not receive the full immunization as was recommended. And the last was that they did not receive any at all. Not because they don't want to, like my colleague highlighted the issues in Egypt or other parts of the world where people have access to the immunization or the vaccines, but they refuse because of different reasons. Here, they don't have a choice. It was not just available. Of course, you could have a small percentage who could still have refused. I'm not saying it doesn't exist, but the greater part of it is that they didn't have the vaccine. And those are the analyses where in the various number of children, where about 56% were fully immunized for age. This is a dip from the 75% that we saw before the war. And then the other not appropriate for age was quite 29%, and then the remaining children were only partially immunized, and a very small percentage, 2%, were not immunized at all. And the take-home message is that the immunization varied across the age group, and especially the age group of the inappropriate for age immunization. That is really one of the focus that some of us are looking at for the longer future, that what effects has this got on these children? Because if they are supposed by 9 months to be immunized, they turn up at 12 months, and then they get all of the immunization. Are they fully immunized? We think no, they are not. And in this current situation, we are like in Sierra Leone, Liberia, and Guinea for the past 1 year, it's been total lockdown. Maybe worst case scenario, the war could have been wherein people were able to move around to run away from conflict situation. But here, a whole community is locked down for maybe 21 days or even longer. The whole country was locked down. So the message some of us are really bringing out to our colleagues is that the children who have never been immunized, as you can see in the conclusion slides, is quite a concern, because if they are not immunized and there are a lot of re-emerging of infectious diseases in addition to what is already being targeted, then we are really heading for quite a huge issue. And we applaud the international community. Some of us as consultants for the WHO, from whatever we have this new vaccine that is called for Ebola. We are fighting very hard, but it is still only for the adult population. We are still yet to get to the children. So we really have quite a lot of issue at hand, and I came specifically to sort of take it as a food for thought to see what else could we do to save the children. We are so far away from the situation at the moment, from Switzerland, from where we are, but it is an evolving problem for those on the ground, and I would really like us to applaud the effort of the current healthcare delivery systems to the Ebola-affected area, and to see what else could be done. So I think that was my short message, and thank you for your attention. Together we can make things happen. That is the motto of our network, and then happy, healthy faces could bring a brighter future for all souls. I thank you very much, and if you have any questions,
or is there a government program which lacks that kind of motivated vaccination?
In the moment, the vaccines are all there, but they are not able to effectively access the children because of the health crisis. And that is what we want to highlight.
And also vaccines require a cold chain.
Yes.
That could be a problem.
Exactly, there you go. The problems are so many, I don't want to make it to paint such a gloomy picture here, because the cold chain is already broken, which means the vaccines in the villages or out of the capital cities are no longer viable because they are not kept at the required temperature. There is no light. They used to depend on gases to keep this UNICEF refrigerator that use gases. All of them have been. There is no supply of gases to the villages, so that's when the vaccines are all finished. So this is to highlight the problem, to think further, how do we tackle it?
There are some reluctance of the vaccination, even in the States, as United States, as well as in Canada. Those religious groups who are rather reluctant to take their children to be vaccinated. And is there any problems associated with that kind of reluctance in African countries?
There is, but it's not a huge issue per se, because the original publication, you can see that all the group, the Islamic group, the Christian in action, so we try to develop a holistic group. There are drawbacks, but it's not as huge as the problem of accessing the vaccines. That's why you can never get a zero or 100% acceptance. It's always a little confounding factors of these religious or even cultural issues. That is very also good.
You as a physician, I guess you have to proactive to promote vaccination in African countries.
I agree very well, which is why for the Ebola vaccine, I myself will be taking that vaccine. I was not, fortunately at the start of the clinical trials, because of my position with Swiss Medical, I was not allowed, but the WHO, the Deputy Director General Kinney, took the vaccine, the VSV vaccine, and some of us will be actually going down when they give the green light to give the support. Out, not for personal protection, because we have lost so many of colleagues, and we need to get things back on track. But it all starts with thinking about it far away from the situation here, and then we can, in our quiet moment, think about it, how we can help. That's the message here. Yes?
Is there any study on vaccine effectiveness in the African countries? Because there are some reports from India shows the same vaccine is not as effective in the developing countries compared to industrialized countries.
That's very correct. And then we are still looking at issues like that, the genetics, the genomics of the people. Even with the current Ebola vaccine, a smaller group in Sierra Leone are looking at the effectiveness of the vaccine in the colored population or the black population, because the genomics in the Caucasians are totally different. This is also one of my PhD studies. I'm looking at the enzyme metabolism among Africans with drugs. So you are correct. I mean, the efficacy may not be 100% guaranteed. So therefore, we need more studies, but that will take a while. But we are still pushing the research, like what I do, with bringing the colleagues together to look at operating research, not as something totally after the war. Like what you are seeing is purely observational to see what are the effects. From there, you can build up from the observation, and you can go to hypothesis testing, etc. But it's still a long way, but all is not lost. We are still pushing.
Okay. Thank you very much.
Yeah. Sure.
Where did you get your vaccine?
Where?
Yes.
Where do we get the vaccine?
Yes.
Normally, it's from the UNICEF. UNICEF are the main, because it has to be, the sensitivity, specificity has to be guaranteed. So I think it's one source that is pushing the vaccine. Of course, with the other UN agencies, WHO, etc. But UNICEF is the main driver, as far as I'm officially informed. Okay, thank you very much.